This is Abia COVID-19 update.
Abia COVID-19 update.
You need to know that about 26% of the confirmed COVID-19 cases in Nigeria are from unknown sources, and that's according to the report by the Nigeria Center for Disease Control, NCDC. 27% of the cases in the country involved people with travel history. 35% were contacts of those with travel history. Maybe that will answer your question, because the earlier you believe, the better for you and your neighbors. This is Abia State COVID-19 update. My name is Michael Oni. On this program, we highlight daily report of the Inter-Ministerial Committee on the Control of the COVID-19, as well as Abia State Governor Okeze Ikpeazu's efforts in ensuring that the state is safe from the virus. It is running simultaneously every weekday, from Mondays through Fridays, on several radio stations in the state. Live on BCA 88.1 FM, Flow 94.9 FM, Vision Africa Radio 104.1 FM, all in Umuahia, the capital of the state. We're also live on Boz 89.7 FM and Real 99.1 FM, both in Aba, the commercial capital of the state. Now, let's take a look at the situation globally. Over 2.6 million infections of coronavirus have been recorded globally, leading to the death of at least 184,000 persons. About 500,000 new infections and 50,000 deaths have been added in less than 7 days, as the tally grows steadily. Now, Nigeria, Africa's most populous country with over 200 million populace, has conducted only thousands of tests while having the case count of fewer than 1,000. Now, the United States has more than 4 times as many confirmed cases as other countries. The United States has by far the largest number of cases, with more than 849,000 confirmed infections. Now, this is more than 9 times the number of reported cases by China. Now, the United States also has the world's highest death toll, with more than 47,000 fatalities, including almost 15,000 in the New York City. Now, let me bring it back home. In Nigeria, 91 new COVID-19 infections in the country, bringing the new tally of the infected people to 873. That was reported yesterday by the Nigeria Center for Disease Control. The number of reported cases in Lagos, that's the epicenter of the outbreak here in this country, also surpassed 500 for the first time. And of the new cases, Adamawa State recorded its first case of the virus since the beginning of this outbreak. Now, a breakdown of the latest update shows that 74 of the new cases were reported in Lagos, 5 in Katsina, 4 in Ogun, 2 in Delta and Edo, and 1 each in Kwara, Oyo, Adamawa, and the Federal Capital Territory. So now you have an idea of what the situation is in the world, talking about globally, talking about Nigeria, and of course in Abia State we still have 2 confirmed cases. That's as of the last count, of course, as released by the government and also by the NCDC. Now, this morning we're joined by the secretary to the state government and also the chairman of the Inter-Ministerial Committee on COVID-19, talking about Barrister Chris Ezem. Good to have you join us this morning, Barrister.
Michael.
Thank you very much, Barrister. Now, our interest is the welfare of the frontline health workers. And of course, we need to get an update on what has happened from the last time the governor addressed Abians, and of course till date.
Yes, Michael, I will. I'm happy you were part of the press crew during the governor's address, and I'm happy you realized the governor didn't miss word in taking up the challenge of our new 2 index case. And then you will agree with me, before then we were all prepared, we know, because it can either be positive or it can go negative. And when it came, not a surprise, because we're already on ground and ready to tackle the situation.
Okay.
And you will agree with me that the governor said it clearly that our frontline health workers, who are the front desk handling this situation, will actually be taken care of by way of allowances beyond what they get as health workers, because they are actually exposed. And then I think we are dealing with that already. You are aware the 2 index cases are right in FMC Isolation Center, and we are giving all the necessary support as a state government to FMC through the CMD in charge of that place to ensure that everything, all hands are on deck, and nothing is left to any risk in respect of the 2 index cases. So I assure you that all the governor said in terms of support to FMC, we have done that.
Okay, I would like to know, talking about the frontline health workers, were they trained for that purpose?
Excellently, they were done. They were trained. We had NCDC officials who came here, trained our staff, trained the nurses, the medical health workers in respect of handling COVID-19 cases.
Interesting.
Yes.
So what about their family members? Is there arrangement for them to also stay away, talking about those infected already?
Okay. This is how it goes. You know, there are procedures laid down medically in handling such situation. And I can tell you what we are doing. Now you have these 2 index cases emanated from FMC. And based on that, all medical personnel who had contacts with them have been isolated.
Okay.
I guess they've been isolated. And having isolated them, the same way now our contact tracing surveillance group have begun their work immediately. In respect of that, the surveillance group have taken it straight from the families of these index persons, all those who visited them, the homes from where they came. And remember, one of them came from a private hospital, from that end too. And the medical personnel who treated them isolated back to their homes. And back, you have to equally contact trace back to their homes. So as you do this, you now monitor them daily to establish which one shows symptom within this period. You take the samples and you proceed immediately to test it. So they have a procedure, and our surveillance team and protocol team, medical protocol, are following those procedures strictly. But I can tell you one thing, we are not leaving anything to chance.
Okay.
The tracing will be done, contact tracing will be done to the last person.
To the last person?
Yes, in the line. The contact tracing will be done excellently well. So nothing is left to chance.
I'm so concerned about the private hospitals now. You know, for example, you might have a case in an hospital and you do not know, you may not have an idea of what is going on in those private hospitals. Do you have a synergy with private hospitals in Abia State? How is the committee reaching out to private hospital for easy response on suspected cases?
Now, it's simple, because somebody comes to the hospital, shows semblance of malaria. Are you getting me?
Yes.
And then you treat that. I'm not a medical expert. I hope you know that.
Okay. I do know. I do.
But from my chairing COVID-19, I think I've come in contact with so many medical people and interactions. I can say a bit of this. If you are treating the person for malaria and is resists for 2 days to the 3rd day, you should raise an alarm. You should raise an alarm, because you already you know how long the resistance will be. And if in between those periods some other symptoms start surfacing, like you say, the cough, dry cough, you know, the throat problem, and the fever increases, immediately we'll call for isolate that person and call for the medical protocol to come take the blood and go for testing. So definitely, with our experience now and what is happening generally within the country, every medical personnel should be on alert. Whether you are private, you are public hospital, whoever is coming to your clinic, you must do every proper diligence, and if need be, call in the medical protocol team. I think that's what should be done.
Okay. It is Abia State COVID-19 update live on BCA 88.1 FM. Flow 94.9 FM, Vision Africa Radio 104.1 FM, and also Bose 89.7 FM, Real 99.1 FM. We do have the chairman of the Interministerial Committee on COVID-19 in Abia State talking about Barrister Chris Ezem. He also doubles as the secretary to the government, to the state government. And of course, we'll go for a break, and when we return, I will take Barrister on ignorance, on dealing with the ignorance about the disease. We have a whole lot of persons on the street of Abia State that we still need to educate concerning this disease. And of course, some persons are flaunting the directives of the government on the stay at home. So I would like to hear from you how you're dealing with that particular compromise by Abians. It is Abia State COVID-19 update.
This is Abia COVID-19 update.
Abia COVID-19 update.
Well, it is no longer news that Nigeria is also partaking in this unfortunate pandemic ravaging the world. And it is very important that you have some numbers right beside you, or right, if you can even have it, in your memory. Some numbers, it might not be useful for you, but it might be useful for your neighbor, maybe your next door neighbor or your friend. So it is important you take this number down: 0700 224 2362. I will take that again: 0700 224 2362. If you have someone exhibiting symptoms relating to coronavirus, it's very important you call that number. That's the Abia Telehealth Initiative number. And of course, 24/7, that personnel on ground to pick your calls. It is Abia COVID-19 update right here, live on several radio stations: BCA 88.1 FM, Flow 94.9 FM, Vision Africa Radio 104.1 FM, Real 99.1 FM, and Bose 89.7 FM. And of course, we still have Barrister Chris Ezem very much in the studio, the chairman of the Interministerial Committee on COVID-19 right here in Abia State. We want to know how you're dealing with the ignorance about this disease. We still have a whole lot of persons, Abians, still claiming that COVID-19 is not real.
Michael, you will agree with me that are we going to, I don't know whether you call it ignorance. I'm not sure is a total issue of ignorance. It's just a total issue of people decided to behave badly. Because I followed what you were saying on radio here. You've read how many stations every day speaking on COVID-19. Virtually the entire stations in Abia are speaking on COVID-19. We are all here every day. The Commissioner for Information is here. The Commissioner for Health is here. Myself is here. The Governor is on the radio speaking to Abians. We do releases regularly on this. At the local government level, efforts are being made. Who will say that he or she is not aware we have COVID-19 pandemic worldwide, not just in Abia, not just in Nigeria? It's a global issue. Even if you are claiming ignorance, now we are announcing to you that Abia has recorded 2 index cases. We have begun contact tracing. We don't know what the results will look like at the end of the day. Will you still say you are not aware we have COVID-19 pandemic coronavirus in Abia State? It's not possible. People are aware, but people just decide to be indisciplined.
Talking about the contact tracing, do you have the number of persons that have been contacted?
I don't have the number as I speak to you here, but what I know is that the surveillance team have begun that in 3 folds.
Okay.
3 folds as it concerns medical experts exposed to the index patients, the virus patients right now, their families, their homes where the patients even came from, including the hospital where one was transferred from to FMC. So we are doing a 3-fold contact tracing procedure.
And I believe testing have begun.
No, definitely, yeah. Every day we are now with Abakaleke with
test samples.
Yes, exactly.
Okay, I would like to take you on the issue of some persons flaunting the directives given by the government. I can tell you that there are markets that do open early morning here in Abia State, and also late in the evening. And of course, it's like this: the street returns back to normalcy later, maybe after the surveillance team have ended their work for the day. That's the situation. I can tell you that, Barrister.
I will speak on that. Let me take it from this perspective. One, we have, you may say, some were dealing on the issue of believing us, living in ignorance that you don't have coronavirus in Abia. Today you have it. So what would be your excuse of exposing yourself? But right now, we're putting in place mobile courts. The mobile courts will operate in Omaha, one in Aba, one in Ohafia. And we are empowering security agencies and the enforcement teams, both at the state and at the local government level. Once any offender or defaulter is found, you just go to the mobile court and you are tried immediately.
And if found guilty?
Definitely you are fined.
Interesting. So now it's very important that you do not flout government directive. Let me open the phone lines. If you want to participate and you have questions concerning the activities of the Interministerial Committee on COVID-19 in Abia State, we do have the chairman of that committee right here in the studios. It is 0808 182 6949 or 0811 605 2949. You can also drop messages on 0906 510 8289. Good morning to you.
Hello, good morning.
Good morning.
Oh, good morning, our guest.
Good morning.
What's your name?
My name is Stanley from Omai.
Welcome.
Please, I want to know how can we get our face mask and the sanitizer. I'm calling in Omai North. How can we get our own? I heard that the government is sharing to every people, and I've never received my own. How can I get my own?
All right, the barrister will answer that question.
Thank you. I know the governor of Abia State, my boss, recently has made an order making face masks compulsory, and then if you have to be out of your house for any reason, you must wear face masks anywhere you are to prevent the continued spread of coronavirus in and around Abia. I can assure you that we are putting things in place to send a large number of sanitizers and face masks through the local governments down to the various communities. That will be done soonest, in the next 1-2 days, 3. We'll have that out. We'll send sanitizers, we'll send face masks through the local governments down to the various communities, which will go through the President General as women leader, traditional rulers of the communities, along with some other palliatives. We'll do that in a few days. Thank you.
Hello, morning to you. Good morning.
Hello, good morning.
Good morning.
Please, I'm Mr. Osita.
All right, you're welcome.
Calling from Omaya.
Welcome, Mr. Osita.
Please, I want to say that first and foremost, I have to thank the governor for his efforts, which he has been putting in this COVID-19. Please, I still want to plead with the Honorable Secretary to please invite one of the resource persons, precisely the medical director, who will now give us one of the tips as regards on how this sickness is being cured. Because we are always surprised when we hear that some people have been cured and they have been discharged. But we have been hearing that there is no medicine for this particular pandemic. So please, I would like them to invite one of the resource persons, specifically medical director, who will now enlighten the masses on how this sickness is being cured. Thank you.
All right, thank you. That's noted.
I've noted that, and that will be done. But I assure you, we'll have the medications to administer in case of any coronavirus patient we are handling. But I want to assure you the Commissioner for Health will be on board to throw more light on that. Thank you.
Hello. Good morning to you.
Hello, Mr. Anyanwu from Mission here.
All right, you're welcome.
Yeah, thank you for the program. Please, I love the program very, very well because it's educating people. But the issue about it that we are imitating foreigners, but we cannot even implement other ones the way that it will favor others.
I didn't get your question. How are we imitating foreigners?
Now, they are just putting lockdown in foreigners. They are put for lockdown, but there's no implementation of supplying the access that people will live after.
All right, I didn't get that well, but I think he might be talking about palliative.
Yeah, Mr. Anyanwu. Mr. Anyanwu, I think you have to understand we are not imitating foreigners. Lockdown is necessary. It helps to keep people. If people obey it, it means you stay home except it is essential, you're out on your essential service, and that will reduce contact and that will reduce the spread of this. That place you are going to, how do you guarantee the person you are going to meet there does not have coronavirus? If that person is infected and you interact with the person, you go home, you spread it further to members of your family. That's why we are doing that. And government will continue to release palliatives within its own ability to ensure that we reach the vulnerable, the less privileged, and the downtrodden. Thank you.
Hello, good morning to you.
Hello, good morning.
Good morning.
Chukwudi calling from Aba.
Welcome, Chukwudi.
I want to thank the governor and the state government for the awareness created so far concerning this COVID-19. And I want to tell my fellow Indians, the government is doing this for our good. It is good and better to suffer hunger for a while than to suffer this terrible pandemic. So let my fellow Indians stay away from public, stay indoors, because as you go around, you will see people moving around. Go in the market, even cemetery, Ayofu, Road, area, go period. People are just packed there doing their businesses on the roadside. And all this thing is what the government is fighting, that this pandemic should not spread in other states. I don't know if people are listening to international news. What is happening presently in Italy? What is happening in various nations of the world? And the government is doing everything to prevent such things in this state. And people are not helping the matter. So I thank the government so much, and I plead with my fellow Indians to give heed to the government in order to stay indoors until this very pandemic will come out, and God will help us to live our normal lives.
Thank you very much, Chukwudi. That's very apt. Barrister Chris Ezem, I want to really appreciate you for your time this morning on the program, Abia State COVID-19 Update.
Thank you, Michael.
And we hope to have some of your men to curtail, some of these persons flaunting the directives of the government on the street of Abia State to curtail the spread of this virus.
I want to assure you, Michael, will strengthen our enforcement team, and with the mobile courts put in place, and they will start working effectively any moment from now. I'm sure when we make one or two scapegoats, others will stay back.
That's it today on Abia State COVID-19 Update. Thank you very much to all the producers of the partnering stations, talking about BCA, Flow FM, Vision Africa Radio, Bose FM, and Real FM. My name is Michael Oni. The program will be back on radio tomorrow.
This is Abia COVID-19 Update.
Abia COVID-19 Update.